Hello everybody, we are here from the Moducare.com.Canada page for Instagram Live today. So if you guys are following us, make sure you let us know where you are located across Canada, and we are going to get our special guest here in 1 second. And of course, my name is Caitlyn Vanderhaeghe. I'm the president and CEO of KidStar Nutrients. We make great quality products for the entire family, never include sugar, artificial colors, or flavors. And today we are on the Moducare page, and Moducare became part of KidStar Nutrients a couple years ago. And so we are the exclusive supplier of Moducare in Canada. And today we have Lorna Vanderhaeghe, our special guest, here to talk about autoimmune diseases. So thank you so much for joining us today, Lorna. And of course, another special topic. And I did want to say, before we get started, what I have in my office. So you know, who's that lady on the back there?
Yeah.
So welcome, Lorna.
Well, thank you for having me. Back in 1998, I wrote a book called The Immune System Cure, which back at that time, nobody really knew much about the immune system. And I had the great pleasure of meeting the researchers and founders behind Moducare and all of the work that they had already done for several decades before I got involved with them. And then I was so fortunate to be able to be part of growing and teaching people about Moducare around the world.
I know, and with all that, I was also very lucky because I think I started taking Moducare when I was in grade 7. And then when I graduated university, you took me to South Africa, and I got to meet the owners of Moducare and their family and the story behind everything. And it was a memorable trip for sure. You know, we got to do the whole South Africa experience, and I would love to go back again with you very soon. But today on this topic, we are talking about autoimmune diseases. So I thought we would jump right in. And number one is, what is an autoimmune disease? Let's start from the basics.
So you have this immune system. Its job is to protect you from viruses, bacteria, fungi, cancer. It's also involved in inflammation, which we'll talk a little bit about. Your immune system is also involved in allergies. It keeps you free of cancer. The immune system is constantly seeking and recognizing and destroying invaders, balancing things out so you stay healthy. And the immune system is made up of different organs and tissues. So the skin is the largest immune organ, and that makes sense because it protects the inside of your body from all of the bad things on the outside of your body. And, you know, your immune system has like the thymus gland, and then there's lots of microscopic cells that secrete what we call cytokines, or I call them immune warriors, immune messengers. Literally, you've got an army inside your body, and its job is to keep you healthy from all of the things that could hurt you. With autoimmune diseases, this is a very scary type of condition, because what happens is this immune system that is so voracious at killing off invaders gets very confused. And instead of attacking a virus or a bacteria or a cancer cell, it turns on the body's tissues and it destroys them. So in the case of MS or multiple sclerosis, the immune system destroys the covering on the myelin sheath. In the case of things like Hashimoto's thyroiditis, your immune system is attacking your thyroid. In the case of autolymic hemolytic anemia, your immune system is destroying your red blood cells. And of course, rheumatoid arthritis, your immune system turns around and starts destroying the joints. So it's very, very aggressive, very damaging. Autoimmune diseases affect women more than men. So we believe that there is a whole hormone component associated with that. And we know that these autoimmune diseases are on the rise.
Yes.
So we're seeing a lot more of them, people with multiple autoimmune diseases. Type 1 diabetes, for example, is the childhood diabetes that we see in kids, where their immune system is attacking the pancreas, so the pancreas can no longer make insulin. Right. So that would be one that we see in children, along with pediatric rheumatoid arthritis, which is another one we see in kids very commonly as well.
And when you said that we're seeing it a lot more, you know, we really are, and especially even with actresses. Like the past 2 years, the amount of actresses that now have multiple sclerosis or another autoimmune disease, like they're almost like popping up everywhere. And either that we're just being more aware of it, or maybe with social media we see it more, but it does feel like now everyone you know has some sort of autoimmune disease.
They are
and the other thing, yeah, you're right. And the other thing you and I were talking about earlier, when you're pregnant, do some people go into remission? Is that a thing?
Right. So a couple of questions there. One, why are we getting more autoimmune diseases? What is causing autoimmune disease? So first off, there is this belief that there are some autoimmune diseases that run more in families. So for example, in twins, if one twin gets an autoimmune disease, it's very likely the other twin will get an autoimmune disease as well. So we do know there's something related with genetics. If your mom had multiple sclerosis, you're at a higher risk. It doesn't mean you're going to get it, just means your risk is higher. We know that we believe that viruses or viral infections or bacterial infections are initiating it. So for example, the way to explain that is you had a really bad viral infection, and then a couple of weeks later, you start to see symptoms of an autoimmune disease, or 3 months later, something like that. Why is that happening? Well, initially, you had a viral infection or a bacterial infection. The immune system recognized it, tried to destroy it, and then it's actually gone. That's the theory. But the immune system still thinks it's there.
Right.
And if it believes there are remnants of that bacterial infection on your joint tissue, it will just keep trying to clean it up, attack it, destroy it, get rid of it. But what it's really doing is attacking healthy tissue.
Right.
So we believe that there's a component with autoimmune diseases that they were initiated by viral or bacterial infections. And a lot of people who get autoimmune diseases will say, oh yeah, I was really sick. Well, what did we just go through? One of the biggest pandemics worldwide ever, with a very serious infection. Sure. And so now what we're seeing is this huge increase in autoimmune diseases. The second question you asked about when women get pregnant, sometimes they go into remission. Yes, because we know that women are more susceptible to autoimmune diseases. They believe that it has a hormone component, whether it's too much estrogen, not enough progesterone. But when women get pregnant, their progesterone levels go skyrocketing. That's what keeps you pregnant. They believe progesterone is protective against autoimmune diseases. So in some conditions, some autoimmune conditions like lupus, they actually give women super high doses of progesterone to control the lupus. So the immune system is complicated, but I'm going to simplify it. We don't want our immune system like a teeter-totter. That's when you have elevated stress hormone cortisol, decreased DHEA, which is a very powerful anti-aging hormone, but it is also your immune balancing hormone. So when cortisol goes up, stress hormones go up, DHEA drops, and we end up with this dysfunctional immune system with too much inflammation. And what is inflammation? Because everybody banters this word around, but people don't really realize what it is. Well, inflammation is the immune system's first response. So your immune system creates inflammation to kill off invaders, viruses, bacteria, those kind of things. And what are the symptoms of inflammation that you can see? So redness, pain, swelling, and heat. So if you slip and fall on the ice and you sprain your ankle will get red hot, painful, and swollen. That is inflammation that you can actually see because it's on the outside of the body, but we have inflammation going on the inside of the body. And when you have an autoimmune disease, you have a ton of inflammation. And this is what causes a lot of pain for people, destruction, and a whole host of nasty symptoms. And you know, we have a huge list of autoimmune diseases: MS, lupus, scleroderma, Hashimoto's thyroiditis, Graves' disease, Crohn's disease, you know, all of these types of things that are on the rise, as you said.
Well, and as you were saying that, actually, before we went on here, I actually went up to look at the top 10. And then sometimes you kind of forget what is an autoimmune disease when you're looking at it. But then, of course, the Crohn's, the colitis, ulcerative colitis, and of course, it's inflammation of your gut. So, you think about it, sometimes we only think about autoimmune as being MS. It's only a few things, but it's actually a number of them. Psoriasis.
Yeah.
Like some people have, I just have psoriasis, and they don't really think too much about it, but it also is an autoimmune disease. Well, so with this long list of potential autoimmune diseases that people can have, what are some ways we can either, I guess we can't really prevent technically, because if you had an infection that didn't go away, but what can we do afterwards that can help us reduce our inflammation and start feeling better?
Well, I think we can prevent them. So we'll talk about that in a minute. A couple more autoimmune diseases are things like pernicious anemia.
Oh, yes. That's the B12 one?
Autoimmune hemolytic anemia. Okay. And interestingly enough, getting ready for this talk that you and I were doing today, I looked up the connection between iron and autoimmune diseases. And you know that you and I are very, very focused on iron deficiency and iron deficiency anemia, and the fact that it's the number one nutrient deficiency. It's worldwide. It's very commonly seen in women and children. Yes. And I think people need, especially if you are a mom or a grandma or a parent on this call, you need to really pay attention to what is going on with your iron levels in kids. Because in the first month after a baby is born, iron is needed to make the myelin sheath. So when we see MS patients, they have a degradation of the myelin sheath. Well, nobody's actually done these long-term studies looking at what happens if you have a child and grandma has MS and the child is born and mom is anemic and then baby is anemic and they don't get a nice thick myelin sheath grown on the ends of their nerves. Mm-hmm. And as a result, they are at higher risk of MS because they didn't get a simple nutrient at the beginning. So maybe we can prevent these things. And if you have a family history of autoimmune disease, then you should be on Moducare, fish oil. Make sure that you don't get anemic. There are a lot of these autoimmune diseases are associated with anemia. Right. So low iron, because someone simply did not diagnose anemia properly. And fatty acids are absolutely key. Things that support the immune system, like vitamin D. We know that MS is seen predominantly in northern countries that don't get enough sunshine year round. Remember, you have to get 20 minutes of full sunshine on a naked body every day to make enough vitamin D. Well, obviously that's not happening here in Canada or in the northern US or in northern Europe. And so you better be taking a vitamin D supplement. So there are some key supplements that I believe are absolutely essential that our children should take, that we should take every single day to prevent these things, to get our immune system back focused on the way it should be acting, not this overactive mechanism.
And with Moducare, because it's a daily immune supplement, so we take that all year round. And it also helps with other things than just autoimmune diseases, because it helps balance your immune system, just like you were talking about with the teeter-totter. We want to make sure we're nice and even so that our body can react to what's occurring appropriately. My kids take it, of course, for colds and flu seasons. Also, one of them has a little bit of the allergy line on their nose. So the pediatrician saw that right away, and they were like, oh, we should make sure that we're paying attention, that they don't have allergies and they're not going to develop anything additional. Because if anyone out there listening, if you see that little line, it's like what would you consider that?
Or the nostril that's long because the kid is constant, or the grown-up that's doing
that's always doing this.
Here's a little line here, Kleenex, grandma with the Kleenex up the sleeve all the time. No, Moducare is an immune balancing supplement. So what that means is it keeps your virus and bacteria fighting part of the immune system nice and strong. Mm-hmm. Your immune system can then seek, recognize, and destroy cancer cells, which are unfortunately marauding every day. and it keeps the inflammation functioning normally. So we want to have a little bit of inflammation to protect us. We just don't want to have chronic inflammation. Chronic inflammation causes things like osteoporosis, osteoarthritis. All the 107 different types of arthritis are linked to inflammation. Rapid aging is also linked to inflammation. That's because your DHEA drops. And I tell people all the time, there is nothing that works like Moducare.
It's true.
To enhance your DHEA naturally and bring your cortisol down. You know, everybody's looking at adaptogens, things like ashwagandha and rhodiola and suma, things like that. But Moducare will bring your DHEA up and bring your cortisol levels down, balance and calm your immune system so it functions properly. And the only people who cannot take Moducare are people who've had organ transplants.
Yes.
And are on rejection drugs, or people with MS. And even then with the MS patients, it's only because we don't always know which side of the immune system is not working properly with MS patients.
Yes.
But everybody else.
Yeah. And we do have some practitioners, medical doctors, that have prescribed Moducare to their MS patients, but of course they're following them and ensuring that the protocol is being met. So yes, you're right. And it's such an easy product to take. There's chewable, tastes great. There's a capsule if you really want to swallow the product. You know, everyone in our house loves it. Frequently I get the kids ask, well, how many can I have? And then I tell them and they say, can I have more? And I'm like, okay, one more.
Yeah, they're very, very yummy. And it's the natural, great flavor. And there's no sugar or artificial sweeteners in it as well. So, you know, Moducare is one thing you should be taking every single day. You also need vitamin D3. Every day you should take vitamin D3.
Yes.
And if you have children, they should be on vitamin D. They should also be taking omegas.
Yeah.
So you want both adults and children to be taking omegas. And if you're pregnant, you should be on vitamin D3. You should be taking omegas. And yes, you can take Moducare while you're pregnant as well. It is completely safe. And one thing we have to talk about is not taking immune boosters.
Yes.
I just taught you that autoimmune disease is an overactive immune system. It's a highly inflamed immune system. You don't want to jack up or boost that part of the immune system. You want to calm it down. You want to make the immune system back in balance so that it can do its job properly. So avoid immune boosters. They actually did a study using echinacea, which is an immune booster, where they found that this was a study done at Bastyr University, where people who took echinacea every day actually got more colds and flu than the people who didn't take it. Not such a great study for that herb. But you don't want to be taking immune boosters. So if someone is doing a lot of marketing telling you, oh, boost, boost, boost your immune system with this product, you don't want to take that. You want to take something that calms the immune system. And I got to go back to the iron thing, because I really truly believe, if you're pregnant, you need to do everything in your power to get your iron levels up so that your baby is not born deficient. Yes. And then if there's any doubt, request that they test your baby's iron level right at birth. It's so key for a healthy immune system, also for brain development, for cognition, you know, to prevent things like ADHD, and also to give your child a better start on life.
Yeah. Oh yeah. No, we continually say, if they're testing, test. And if you have a doubt, test. Like, I have one friend who was monitored throughout her pregnancy, and they said your iron levels are good, they're good. And then baby was born and the APGAR was low. So of course that's routine to get blood work done for the baby right away. And they found out the baby still didn't have good enough iron, even though mom had very good iron stores throughout the pregnancy. It was a full-term baby and there were no complications at birth. So the fact that we are not testing every single baby is mind-boggling. And we're already doing a heel prick. We can also test for iron. It's not going to be any more invasive.
No. And, you know, there is this fear around iron. I don't know why. I think it's the childproof cap on the bottle. Because ultimately, we should be getting 20 milligrams of elemental iron from our diet every day. And according to the latest research, we are only getting 8 milligrams. Now, that's if you're eating red meat, egg yolks, and foods that are high in iron. I can tell you, kids are not doing that.
No, they're not.
They're not lovers of liver and red meat. Often they pop the egg yolk out and just eat the white, like your daughters.
That's my daughter.
And we just are not eating those iron-rich foods, especially if you're a child. And so we need to supplement.
Yeah.
And you have great iron supplements for that reason. So, I think it's a big component, making sure your kids have the nutrients they need for a healthy immune system, like vitamin D for adults and children, omega-3s, fish oil, DHA, algae if you're vegetarian, but you need it. You need it for your child's development, for their immune system, and take Moducare every single day and don't stop, because right now we're in allergy season. If you started Moducare a few weeks ago, you probably noticed that you don't have any allergies this year. And in the fall, when kids go back to school, everybody gets sick. But if you take Moducare every day, your immune system is able to do its job properly.
Right. That's very true. I want to make sure we didn't miss any of our questions on my list. So we know what an autoimmune disease is. We know what they're called. So we now know which ones there are. We know that there's a hormone connection. We know that more women are affected than men. We know iron plays a huge role in this. Of course, nutrients help our body deal with this. And I think those are my big ones. And then, of course, the pregnancy one is always very interesting to me, how some women go into remission. So I did think we hit all of our topics today, which is, I think we're getting better at this, Lorna.
We are. So does anybody have questions in our group?
Oh, we got one right there. We are also low and no testing is being done. Yes, so depending what province you're in and what your practitioner is like, thankfully for us in Vancouver, most practitioners are very open and willing to test kids and adults to ensure that their levels are adequate, once or twice a year. They don't really push back a lot. I do know in some provinces, they are not as open to testing just to find out. But you know what? It's our tax-paying money that is paying for this, so push for it.
Well, and the other thing is, look at your child. I remember when I was in health food stores doing book signings, and parents would come in with their kids, and the mom would be coming in looking for iron for herself. And I would look at her children and go, actually, it's more important your children take the iron.
Yes.
If your child is pale and their hair is thin and wispy, and you pull down the eyelid, so you got to pull it down like this and look. Is it pale? Is it light pink? Or is it bright red? It should be bright red.
Yes.
And if that little edge on the inside of the underneath part of the eye is not bright red, your child needs iron. Do your kids have dark circles under their eyes? They're low in iron. It's very simple, but because as parents, we see our kids every day, we don't notice these things, but other people do. So grandma, if you're not there every day and you go visit your grandchildren and they're pale, do the little iron check on your kids. And if it's low, then put them on iron. It's not going to hurt them. The dosages for children are only 10 milligrams a day, very tiny dose, which are found in your supplements. 15 is for pregnancy times 2. So I think 28 milligrams is what Health Canada recommends. But this is a minor amount. This is something somebody can take every single day and not worry.
Oh, Lorna, there's another question in there.
Okay. So how much fish oil? Is this for children or adults? So for adults, I want to talk about fish oil in adults or omega-3s. You need 4,000 milligrams of omega-3 per day. Bruce Holub, PhD, was one of the original fish oil researchers. He's at Guelph University, extremely smart man. He leaned over, I luckily know him well, and said, Lorna, you have to take 4,000 milligrams a day. Nobody is taking enough. So if you're an adult, if you're a child, I think your spray or your omega-3 little poppers are
500 for 2 little chewables.
Yeah.
But even then the pediatrician recommended 1,200 to 2,000 for children with any behavioral differences.
Right.
Of fish oil.
Right.
Yeah.
Okay. So when you're looking at omega-3 fish oil, you want to have for your child, just so we can be really clear for the person who was asking, 1,200 to 2,000 milligrams a day. For adults, it's 4,000 milligrams a day. And of course, it's not just for your immune system, it's for your eyes and your brain and longevity and your heart health. So very, very important. And, you know, I always say to people, they're kind of like foundation nutrients that you take every day of your life. You take fish oil, you take vitamin D3. And what are the doses of vitamin D3? Kids should have 1,000 IUs. Adults in the summer, 2,500 IUs, and Health Canada changed the minimum dose to 2,500 IUs. So that's not a lot. In the winter, adults should take 5,000 IUs. If you have MS, they have people on 10,000 IUs of vitamin D. So, you know, we're not talking about something that's completely crazy here.
Yeah.
This is just basic. And then Moducare every day and your great multivitamin with minerals. Those are the kinds of things. And of course, eating lots of fruits and vegetables and good healthy fats from extra virgin olive oil and avocados and coconut oil, and then good clean sources of protein from fish, wild, free range, whenever you can, beef, chicken, lamb, those kinds of things.
Yes, I agree. And the other thing was that the person that commented, they were saying about dyslexia and ADHD. And so for that, when you are going to your pediatrician, make sure they have to test your blood work, because they need to know if you have a nutrient deficiency before they then decide to prescribe you a drug. They need to know your baseline. So push, push, push. You want to know if your kids have heavy metals that are out of whack. You want to know if they have low B12 and ferritin and hemoglobin. They need to know these things so that they can actually treat your child for what they've been diagnosed as.
Well, and here's another really important fact. If you are anemic or have iron deficiency, iron kicks out the heavy metals. So when you become anemic or deficient in iron, the bad heavy metals like cadmium and those things build up in the body.
Mm-hmm.
So it's important. I know that a lot of kids who the doctor suspects or pediatricians suspect have low iron also check for heavy metals.
Yes.
Because they know iron is so protective. It protects us from all these other bad heavy metals that are out.
And I want to talk about kids products versus adult products. We do have a lot of people that say, oh, I just give my kids the adult product. And I want to point out, with Health Canada, when you release a child product to the market, there is a long list of tests you must do, and the minimums allowable of things on that certification of specs is very low for children. So if you're looking at heavy metals, it's next to none. You are basically not allowed to have anything, maybe a trace in a child's product. Whereas if you're releasing an adult product, you are allowed to have more of something in it. So remember, kids' bodies are tiny. And so the heavy metals that do go into their body is obviously the ratio compared to a human. That's how they can have an easier time of having heavy metal overload. So do make sure if you're giving your child a product, it is meant for children, and it has an NPN on it from Canada. So it has been released properly.
Right. And I would go one step further. Why not use the kids' products? Because they're better. They're better because they have lower limits of tolerance for any of the contaminants that are allowed. So you know you're getting super, super clean. And that's what I love about all of your iron products, from the baby drops right down to the liquids, to the chewables. They're delicious. They have no junk in them. They taste fantastic. We just finished doing the Canadian Health Food Show, and every single person who came and tasted the products were like, wow. They all said, this actually has iron in it. I can't taste it at all. It's delicious. It's yummy. And we had lots of kids that came and loved the product. So
I know my husband takes the Omega, and he says, why do people take adult products? These ones just taste so much better. Yeah. And I was like, I don't know. They should just take the kids' products. They taste so yummy. Yeah. So thank you very much, Lorna, for being here today on our Moducare page for our Instagram Live. And we will have another one coming up in a few weeks. So if anyone has any burning questions they would like us to answer, or a topic they would like us to cover, please send us a message. We are looking forward to the next one. And thank you so much, Lorna, again. Appreciate it.
Thank you. Bye-bye.